Right, so this is a hot topic that I kind of disagree with RFK and other people because I'm an actual doctor and I don't just make up all these random stories. But let me put it this way. Neurodiversion, what's the difference, right? The word divergent means your brain goes one way, and the categories are ADHD, autism, intellectual disability, global developmental delay, and developmental delay, and includes some learning disorders. Now, a majority of the other type of mental illness are stress-induced, right? So can you inherit it? 100%, because autism, all the neurodivergence, there could be some trauma-induced, like let's say you were hit when you were young and it was very traumatic. You might inherit intellectual disability, but usually it runs in your genetics based on environment, exposure, genetics, right? So I'll have a parent that has 4 kids with autism. It's not by coincidence. It's not by their vaccines or whatever is stated out there, which is not true, right? And so the other part is, can you get depression and anxiety from genetics? And yes, 100%, because in big meta-analysis, they look at parents that have kids, and as their kid is getting more stressed out, they're leaning towards one condition or the other. Not always, but it's almost like their genetics for vulnerability or susceptibility to a condition is going to happen. What I do find is when a neurodivergent kid is not treated, let's just say ADHD, I will see them come to see me about 10 years earlier than what the age onset of anxiety is. Here's why. Your brain gets so stressed out, right, by its own genetics of ADHD, but then because the environment plays such a big role that the other genetics will kick in faster. So I just recently saw a 5-year-old that had both, and I was just amazed at how fast kids are acquiring it. And I will not be surprised to say, and I'll put it out there, that more younger kids will come with anxiety and depression because lack of exercise, lack of parental support, poor modeling, genetics kick in faster because as each generation goes down, as much as technology improves, we inherit the condition faster. So early screening is 100% important to prevent the other possibilities. Let's say you have ADHD, you get treated faster, it's less likely that you'll get anxiety or depression, at least not early on, but maybe later on. And that's okay, because at least by then it wouldn't have created a huge calamity in your life.